I'm Mo. It's great to join you all today for a case study on Kwashiorkor, which is a subtype of malnutrition that we see commonly here in Ivory Coast. But first of all, just to share a little bit about myself, my name is Christine McLaughlin. I'm a family nurse practitioner, and I've had the privilege of serving the Lord as a missionary here for the last 13 years. And we love MMO. We've had the privilege of hosting you all several times. The last time was just this past July. And I just so feel like we just share the same burden of reaching people through medical missions. So for this case study, we're going to talk about malnutrition. And malnutrition is an important cause of pediatric mortality in Africa. And actually, Ghana is the most impacted country, which neighbors us here to the east. But Ivory Coast is also a high burden, low income country that's very impacted by malnutrition. Children between the ages of 0 to 5 years old are the most at risk. And for this case study, this is a little girl named Dominique, who we consulted on. She's 8 years old. Whenever we received her through triage, her vital signs were normal, except that she was underweight. So we noticed that right away. She came with her mom and her siblings. The chief complaint was fatigue and not doing well in school. So she has no past medical history. As far as her social history, she lives in the village of Brabo here in Ivory Coast with her mother and 3 siblings. The village of Brabo is located on the lagoon, and her father is a fisherman. He has a dugout canoe. He fishes in the lagoon. And her mother has a fruit stand where she sells fruit in the village. So it is a poor family, village family. There are no current medications or medication allergies. And so we went ahead and brought her in. During her exam, what we noticed right away is that her hair, Dominique's hair, was lighter than it should be. So normally here, of course, our people should have dark black hair normally, but her hair was lighter, more of an amber color, also very brittle hair. Now, moving down for the head to toe assessment, she had very pale, very pallor on her inner eyes, on her conjunctiva, and also dry oral mucosa. And also her extremities were very thin, kind of a decreased skin turgor when we checked that, and a very protuberant abdomen. So her abdomen was larger, and you really noticed that, especially looking at her thin extremities. And she was also quite lethargic, not playing like the other children that were in the same exam room. And so looking at these exam findings, and also at her vital signs, she is low birth weight, or actually just underweight. And you're looking at malnutrition. But first of all, as a provider, whenever you think that you have a case of malnutrition, the first thing that comes into your mind is, what kind of malnutrition is this? Because there's 2 main types of malnutrition that we see worldwide. And the first one is marasma. That's MARASME. And that is a lack of general food deficiency. So it's a lack of quantity of food. And we see that most often in starving populations, especially where there are social factors like there's a maternal absence, or there's a war. So you have displaced populations, and they just don't have enough food. They're starving, literally starving. And in these patients, what we see are a lot of oral infections, especially between the ages of 1 and 2 years old. Oral infections like stomatitis, gingivitis, wrinkled, thickened skin, short stature. And you're looking at usually a younger child, like we just said, and the first thing you think is, this looks like a little wrinkled old person. That's what they say about marasma. And we see this very infrequently in Ivory Coast. So maybe 1 in 2,000 cases of malnutrition, we'll see a marasma's case. What we see a lot more commonly is Kwashiorkor, and that's a protein deficiency. So it's a lack of quality of food. Where we said marasma is a lack of quantity of food, this is just a lack of quality of food. And so the age of onset is normally between 2 and 3 years old. And there's a lot of social factors, ethnic preferences for foods, because it's just a choice. It's a choice. The foods that they're choosing aren't optimal. And the signs and symptoms, a lot of times you see auburn or even yellow looking hair. diarrhea, intestinal infections, the bloated abdomen, the protuberant abdomen, and then skinny extremities and also lethargy. And with complications though, there's a really unfortunate complication with Kwashiorkor, and that's a neurological delay. And so going back to Dominique, our patient, she has symptoms of Kwashiorkor. So that's our number one diagnosis for her. And really her hair, as providers, when you are looking at a group of patients, you see that lighter hair and you just know that hair really should be darker. We call that the flag sign in Kwashiorkor. It's a flag in your head that there's Kwashiorkor. So a lot of times that's the first thing you see. That's our number one diagnosis with her. And secondly, we have a suspicion of anemia. And that's with her pale conjunctiva. And we're doing a mobile clinic, so we don't have the opportunity to do an H&H or a CBC here. So we're saying a suspicion of anemia. And also dehydration with her dry oral mucosa, her brittle hair, decreased skin turgor, dehydration, and also a suspicion of a parasite infection. We always think that with the bloated protuberant abdomen, possibly there could be a parasite infection also, because the parasites contribute to malnutrition and also to anemia. So that they kind of all tie in together. And so what are we going to do for Dominique? What's our treatment for her? First of all, we're going to think about rehydration. And so on day 1, that should be 125 milliliters per kilogram for the first day, 24 hours. On day 2, we're going to go ahead and go up actually a little bit to 150 milliliters per kilogram for 24 hours. And some of these guidelines are more for tropical medicine. This is what we do for our patients in tropical medicine here. So, and also we're going to give her a parasite treatment because we have that suspicion of the parasite infection. And so we'll go ahead and give her albendazole, 400 milligrams for the first dose. And then we'll repeat that in 2 weeks. In 14 days, we'll go ahead and repeat that. And then iron, she needs iron. So 10 to 20 milligrams per kilogram per day for 3 months. And we usually here always give it for 3 months. And that's based on the life of the red blood cell, which is 120 days. And so if we give it over 3 months, then we really think we're going to increase her hemoglobin by possibly 2 points. And then dietary education. There's a big star on that for Kwashiorkor because we know these people are not starving. It's just food choices. And so she needs protein. Protein-rich foods, and especially in Ivory Coast, we're in a third world country, but our people can get eggs. They can get eggs, and that's probably the number one thing that I recommend when I see Kwashiorkor. An egg here costs about 15 cents. So most people can afford that. And this is funny, actually, a kind of a funny story is that talking to Dominique, and honestly, all of her siblings are eating the same food. They all had Kwashiorkor. They all needed eggs. And so I told her mom, let's have them all eat eggs. At least 2 to 3 times a week, have an egg. And when I said that, they all started to laugh. All the kids started to laugh. And I thought I said I misspoke. I thought, what did I say? They're all laughing. And I started to laugh with them. I just couldn't help myself. And you know what they said? They said, we love eggs. They called me Aunt Christine, we love eggs. And they were just really happy with that treatment because I guess they love eggs. So anyway, hopefully they'll be really compliant with that. So anyway, but remember there was also on the chief complaint, whenever Dominique came in, her mama said she's tired, she's got fatigue, but she's also not doing well in school. And that's where we're seeing that mental delay, which can cause really a long-term mental disability. And so with that, it's interesting here because really as a missionary, we're thinking about missions here. And if we can treat Kwashiorkor well and treat them well, then we can also share the gospel well, because in patient populations, there's a lot of Kwashiorkor. Really as a missionary, you have to kind of step back with them and kind of go more simple in your approach of the gospel, your presentation of the gospel. And so if we can go into a village and teach well and treat Kwashiorkor well, then the people will be healthier physically, but they'll also be healthier spiritually because they'll be able to receive the gospel well. We won't have as much mental delay. And so this has been a case study on Kwashiorkor. And I just want to say thank you to you medical professionals there who give of your time and your skill sets and also your finances to come on MMO trips. Really, you open doors that we couldn't see opened really as well without your coming. And so thank you for just your heart for medical missions and for helping us here on the field.